Hello, I'm David Harrington, President and CEO of Center for Neuro Skills.
And I'm Michael Petersen, physician. Um, I'm a pediatric emergency medicine doctor, and it's great to be here.
And this is the Center for Neuro Skills podcast. And in this episode, we're talking to Dr. Michael Petersen about his extraordinary stroke survival story and his unique perspective on recovery as a doctor and healthcare professional. Dr. Petersen or Michael, how are you doing today?
David, it's great to be here. Thank you for having me, and it's nice to meet you finally.
It's long overdue. It's good to have this conversation with you. You know, we're so happy to have you here in good health. You had a very serious stroke last summer. You had an incredible journey, and CNS or Center for Neuro Skills was fortunate enough to be able to walk that journey with you and get you back to your life. And Michael, your perspective in particular is very interesting because you're typically on the other side of healthcare, but in our journey with you, you were one of our patients, and we were able to go with you through that rehabilitation process. Now, so flexing from the provider side to the patient side, it's got to be interesting. So, can you tell us about your life before your stroke and your background in medicine?
So, first off, it's a pleasure to be here. I started out as a pediatric emergency medicine doctor and then went into consulting for about 10 years. I did Accenture, NTT Data Services, and PwC. I went into that field because I wanted to be home more with the kids. And then eventually I moved over to a new job in the insurance space. So, prior to the stroke, I was just living the life of corporate. I work from home. Um, I had an amazing. I have a wife. I have three kids. One's in optometry school, and then two little ones. One's in fifth grade and one's in third grade. And I'm home with one of them right now. She's sick, but uh, so just be prepared. We may have to stop this interview just so I can deal with her. But no, the before the stroke, life was just I was healthy. I was working out three times a week. Um, who knew that I had undiagnosed hypertension?
Well, yeah, who would have known? And by the way, if we have your special guest, your kiddo come on, that would be great. But gosh, it sounds like you were in very good health at the time, and it sounds like you weren't really worried about this, especially with the hypertension. You weren't aware of it. I know that as I age, every single year, my concerns grow greater and greater and greater. But it sounds like this was not even on your radar at the time.
Yeah, I mean, seriously, I was in between primary care physicians. So my primary care doctor retired, and so I hadn't gone to the new one yet. And in that time frame, here I am thinking I'm healthy, but yet I kind of I wasn't perfect, but I wasn't like not healthy. I was going to Orange Theory three times a week. I was working out. I was active, but they call it hypertension the silent killer. So the type of stroke that I had and when I had it, we'll get to that, but is one of the kind that 50% of the people who have it die. And I was very blessed, and I owe a lot to CNS for helping me through get to where I am today.
Well, considering your routine with Orange Theory, exercising, you're very clearly very productive, working, having kiddos, and all that activity that life brings you. It's got to be scary the day that you had your stroke. Can you kind of talk us through what do you remember about that time, and especially for our listeners, what kind of things might they really be sensitive to if perhaps they're having a stroke?
Well, I would just tell your listeners to be prepared to just kind of understand the signs of hypertension, headaches. Sometimes they'll feel it, and they'll feel something's wrong. For me, fortunately or unfortunately, I have no memory of the day. I have no memory for the next 6 weeks after the stroke. So everything is told to me, but here's what I've been told. And we can look at the ring camera. And that morning, I'm out at the pool picking up things because we had a party the day before. And then I went upstairs. My son found me. My 10-year-old, 11-year-old son found me moaning. He's like, "What's wrong with Dad?" And I just said, "Go get your mother." So he went downstairs to get his mom. She came up. and she goes, "I'm calling 911." I go, "Don't call 911." Being a good ER doctor that I am, I didn't want to bug anybody, but she knew something was wrong, and I told her, "I think I'm having a stroke," and I went like this, and who knows why, what signs or symptoms. But what she said is, my son said I was moaning really loud because I was in pain. I had probably, they say you're gonna have the worst headache of your life. That's probably what I had. EMS came. My wife sent the kids up to the neighbor. The kids remember oxygen in my nose and me being carried downstairs by EMS, and they were here pretty quick. They took me to the hospital, which is literally 10 minutes from our house. Um, I went to the ER, and what I was told is that the neurosurgeon, who's only in Austin, I'm going to live in Austin, who's only in Austin for 2 weeks out of the month, happened to be rounding that morning in the ER. And thank God. So he was able to take me to the OR right away, do what's called a craniectomy, which is remove part of my bone plate, clean the blood out, and then I had to wear a helmet, and I had no bone plate. They sent, this is kind of cool. They did send um, the bone to a lab where they 3D printed the one that's going to replace my head. So then I went I was in the hospital for about 2 to 2.5 weeks in their ICU before I went to what's called TIER, which is a rehab hospital inpatient, and then I went to CNS.
Well, Michael, that is absolutely serious, and to hear not only how as you're talking, I was visualizing what it was like for you and for your son and for your wife, and how scary it was for them. And gosh, it just seems like all of us in healthcare, we're probably the worst patients, right? Because we can self-diagnose and we know the right course, and sometimes we're not as sensitive to this as we feel others should be. But this is serious because the hemorrhagic stroke is only about 13% of the stroke cases. But as you said previously, it's about 40 to 50% mortality rate. That's significant. And to hear your journey through the acute treatment is really kind of telling in terms of how important this is and how quickly this can come upon us. But yes, there's only about 25% of the patients who, after 90 days, are functional. And functional is really a loose term, right? But only 10% fully recover after a hemorrhagic stroke. So it is so important to be able to get that medical and rehabilitative intervention as quickly as possible to maximize the recovery. Every second matters. And that recovery process was really intense. Can you kind of speak to what that recovery process really looked like for you, Michael?
You were absolutely right, and that's why I really feel blessed because, um, again, to have to go. I don't like I said, I don't remember a memory at all, but my wife went through the whole process, and what we often think of is that the stroke affects you think of the victim, but the stroke impacts the family. And so my wife had to have her mom and dad come down and watch the kids while she was in Houston with me, or even come back here to Austin and then going to the Austin CNS. She still had to have help with the kids. Um, that being said, my rehab journey is what cracks me up is I remember distinctly telling the OT therapist at CNS that I was only gonna be there for 2 weeks. I go, I'll be out here by September. She wrote down September. He's gonna be gone, and I was there for 8 months. And one thing that I'll tell you is just that the rehab journey is arduous, but it's also intense, and it is like you said, the sooner you get into it, the better. And obviously, you need rehab. You can't. I can't imagine what it would have been like if I didn't have insurance or if I didn't couldn't come to CNS. What my stroke recovery would have been like. It would have probably been um, with significant deficits or with some challenges. And I'm really glad I got to go to CNS. So what started out as when the minute I came to CNS from Tier, they started therapy that afternoon. I thought I was gonna have like the night off. They go, "You're here at 2 o'clock. We're gonna have OT for you, and you're gonna go right to PT." And I went right to therapy. The interesting thing was I had physical therapy, I had cognitive. My wife and I both had the therapist, so we were able to talk to a therapist if we needed it, which we did. I also had what they call PTOT, cognitive therapy, and just in general, it was just an amazing experience. I can go into more detail, but I'll stop right there.
Well, Mike, you said something important too. I think I've been a clinician for about 25 years, primarily in the neuro space, and that is what people think is like, I'll be here for a couple of weeks and it's going to be quick recovery. But you figure what it takes for us to rewire our brains, that neuroplasticity is so important, and the amount of effort that it takes to rewire the brain, from a cognitive perspective, physical perspective, from an emotional perspective, there's a lot that goes on here. And while there is some natural recovery there, the environment demands will cause the brain to be able to rewire itself. And for you to be able to get back on your feet, it's really great that you've been successful and you transitioned to our CNS day treatment program in Austin. And when you came to us, what were some of your biggest goals when you started?
Yeah. So, I mean, let me just say that everybody's rehab journey is unique, and it's unique to them, and everybody's going to have a different rehab journey. When I first came to CNS, I was inpatient. I was in a wheelchair. I had to learn how to walk again. I had to learn how to, and within 2 weeks from CNS, they had me go from the wheelchair to the walker. I was in the walker for about two more weeks to 3 weeks, and then they said, "Mike, it sounds like you can walk by yourself. Why don't you give it a shot?" The point is that I was able to. I was inpatient at CNS for the first 6 7 weeks, and then from there I went as an outpatient right after my surgery to put the bone plate back. And again, there's a false sense that you feel as a stroke patient that you're much better off than you really are. And what I love is that CNS is they had these conferences with my every therapist would come in and say these are the things that Mike's doing well, these are the things he's not doing well on, and to hear that I still needed help was like shocking me. I'm like, what? And but it's what I love is that the therapists are there for your safety. They're not there. They're there for what's best for you, even though you may not know what's best for you at the time. So hearing them tell me, we had these conferences, and part of what they said is, Mike, you're still neglecting this part of your visual field, or you're not walking it as well as you think you are. And like I said, what I thought was going to be a 2 month visit at the most ended up being 8 months, and it was 8 months. It was perfect timing for me because it turns out I needed visual therapy. And what was cool is that CNS had a visual therapist, Kelly, my OT. She was amazing. She got on the phone with a lady who was an expert in visual fields and the visual stuff, and she got me to really work with this lady through telemedicine. And we met with her once a week until I went to my own visual therapist that Kelly recommended, which was perfect because it really helped me. Um, the cognitive therapy, I just can't say enough about how grateful I am. Now at the time, I was like, forget this place, I'm out of here. But hindsight being 2020, it was the best experience that I would ever recommend to anybody, is that they should get the therapy. They should listen to their therapist and trust them. And I think that's where you really sense that you're on this journey, and that rehab journey is a long one.
Well, gosh, those are such great words and great advice to everyone, Mike, and I really appreciate that so much. And I want to underscore a couple things that you said. Number one, we see this with a lot of patients who come through Center for Neuro Skills, is the lack of awareness at the time, and to be able to trust a team. And you've touched upon other important points too, is that you've had a comprehensive team that not only looks at your gross motor coordination, how you move your fingers, or your arm, or your fine motor coordination, like you moving your fingers, your cognition, your balance, your vision. It really takes a comprehensive interdisciplinary team to turn these stones over, to evaluate, to really see what are the issues, so that we can apply the right modalities to really get you back to where you need to be. And it's more than just identifying and treating, but then how then do we apply those skills to real life, such as being able to cook for yourself, to do your laundry, or to go back to work. And And can you speak to in terms of your role as a provider and I can only imagine that one of your goals was not only to kind of be able to manage your family, manage yourself, but at some point going back to work. And what did Center for Neuro Skills do to prepare you for that?
Yeah, that's it was part of your original question, which I probably didn't answer. But it's absolutely my one of my primary goals was to get back to work. I was the primary breadwinner in our family. My wife didn't work. I worked, so I really needed to get back. I wanted to get back just so I can provide for my family. But I think the other so what CNS did to prepare was really cool. Is they did the CR specialist and the OT got together and they created the simulations and they basically tried to replicate my job as much as possible. Now I have a unique job. I'm in the Medicare space, Medicaid space, and I was like, good luck with that. But they were able to. Here's where you're gonna go into the computer room. You're going to look this stuff up. You're going to pretend like you're doing your job. And it's that simulation. And they also had a typing class. One thing I shared that is the probably the singular thing that you guys provided, which helped me the most, was that I live 45 minutes from CNS. And you guys had a driver meet me probably 15 minutes from my house and that driver would drive me every day for 8 months and or 7 months and that transportation was you think it's nothing but it is. You're with this person every day for an hour in the car. You get to really know them. The point is that I really want to get back to work, so even as an outpatient coming into CNS, these work simulations, which were intense, they were really well done, and I love that they got together and they put together this program for me. You mentioned earlier that it's about everyday the what do you call activities of daily living. One thing that CNS really did when I was inpatient is that they took me to the grocery store. They said, "Mike, go buy here's $100. Go buy your groceries," and you had to literally figure out what you were going to do for the week. Um, there was you had chores in this house. I was as an inpatient. You live with other stroke victims, and you get to really know them, but also you have a sense of responsibilities. Make your bed, um, go to the bathroom, simple things. But one thing that I'll share that is that I find is just life saving is that when you're a fall risk, you may not know it, but you really are when you first are walking with a walker, or you might be without it in the beginning. You're still a fall risk. They always had somebody following you, no matter where you went. At first, you find that to be kind of annoying, but you kind of really sense. I actually almost fell, and the lady caught me. The point is, I almost fell because somebody walked in front of me and almost tripped me. But the fact that this person was behind me and caught me was a God saving, life experience, because I could have fallen, hit my head again. Even though I had a helmet, I still would have fallen. But that person was there to catch me. So they have these guides that really will follow you wherever you go. They give you your meds. But they do prepare you for these activities that they live in of what you're going to do when you get home. And without that, I think you would just be reliant on somebody always taking care of you. But they encouraged you to do things on your own. I love that.
Michael, you said it perfectly. Boy, there's so many nuggets here in this conversation. That's twice you really kind of talked about the awareness or the lack thereof, and being enveloped by a team who understands your needs and to be able to surround you with the scaffolding to not only support you in the moment, but how to kind of continue to grow. And you also said something earlier that I also want to underscore is that every person has their unique injury, and how they present with that injury is very unique. But also their life is unique. And so how do we bridge the rehabilitation needs to matching real life? And you have a very specialized job, and to be able to create a program around you with the typing, the work simulation, the case study assignments that you had to do. And one of our philosophies or values is environmental validity. And that means that we want to treat in an environmentally valid space. And the clinical work is really important in terms of the therapy mats, the therapy bands, and all the equipment you would see in that space. But really, in so many ways, the real treatment is out in the world. It is going grocery shopping where you're having to balance, you're having to scan the aisles, you have to think and count money. There have been times where we have had people going back to construction and we had to use power tools and do the assessment or go back to driving if they're going to be a driver. And how then do we replicate that work? We've even had patients climb ladders again because that's what they needed to go back to. And so that environmental validity is really critical in terms of bridging the gap from that clinic space to a real life environment. And you pack so much in that statement that I think is so important. I appreciate you calling that out. So I'm glad that it worked well for you. And how many treatment days did you come per week? What was the intensity of the therapy and the frequency?
So, even though it feels like it was just yesterday, I was there for 5 days a week with therapy, almost 5 to 6 hours a day. That's intense. If you think about it, you're going from one therapy to the next, to the next, to the next. It includes some counseling in between here and there. I just can't get over how when you're there, you're just going through the motions, but what's being watched of you or what's being analyzed is how fast you do things. That it turns out when I first got there and I did this little obstacle course within the clinic, I didn't think much of it the first time I did it, but by the end of it, I did it faster, so much faster, and I didn't realize that I was faster until they told me. There's a physician that's on staff, and you see that doctor, and the doctor talks to you and tells you, "I'm really proud of you. These are the things that I work on. These are the things that you need help with still." Um, you're you to go back to work, you have to hand that doctor your note that says you're okay to even go. So where I love that there's a clearance even for everybody. And I do, you're right that they did a driving simulation for some people. I I didn't drive until well after I left the clinic, but I did go to the recommended driving course that CNS sends people to. And just like I said, I'm indebted to CNS every day because I wouldn't be where I'm at today. I walk 2 miles a day. I swim, I drive. All these things that I do are going to be unique to each person, but their journey is theirs. And CNS, like I love that word scaffolding. It is a layers of scaffolding, and you're not going to know when you're in the midst of the therapy that all this layers are surrounding you, wrapping you around with care until you leave. And you really get a sense of how much care is really put into your journey. And that, I mean, it goes from PT to OT to the CR to the typing classes, everything layers in, and you're really, by the time you leave, you really are ready for entering the world that they're preparing you for.
Well, and Michael, you were surrounded by a team. And again, it goes back to what I said earlier. You need an interdisciplinary team, speech therapy, physical, education. We even did some telehealth and some vision therapy, cognitive behavioral therapy, speech therapy. So, one of the things that is important that I think is often overlooked in terms of therapy, it is that counseling or the cognitive behavioral therapy. You think, you're a professional, you have a very important job that affects many people, you provide for your family, and all of a sudden you go from provider to patient and from autonomous to dependent. And it's very difficult. And there's a couple things I want to highlight here is that awareness and making sure that counseling is part of the therapy delivery process to kind of make those adjustments mentally in terms of where you are and to encourage you to keep going to build out that awareness. But also, you live in your body every single day. And this is why measuring the progress and having those team conferences and reporting out is so important, because you don't see the changes from day to day or maybe even week to week, but having people measure that progress really can highlight how far that you've improved. And I wonder if you can riff on the therapy team measurement, counseling, and those team conferences.
Sure. I mean, first off, the counseling was amazing. The therapist was nice. You don't you check your schedule every day, and you're not going to have counseling every day. You'll have it probably once a week or twice, 3 times a week. Or sorry, 3 times a month. But the point is that it's there for you. If you need more, they'll open the schedule for you. You get to advocate for yourself, which I love. They really promote that there. Say advocate for yourself. If I needed more therapy, they would put more therapy sessions in there. The therapy sessions were great because here's what they do. They take care of me, but they also took care of my wife. My wife wanted to talk to somebody about my situation and what I was going through, and it was hard on her. She has to take also now she's in charge of the house. She has to take care of the kids. She has to take care of the insurance and go through those hoops. So, and I do think that the fact that they're available for her, she used it and she did talk to the counselor and it was helpful. She said she really helped me. So I do think that, to each their own, obviously, but for our family, the therapist was ideal. The piece about, um, you know, recognizing your trajectory, like I said, when I first got there, I thought I was going to get only there for 8 weeks. I go, I'll be here for 8 weeks. But it turns out, 8 months later, you realize what I love about the conferences that they had is that they told you where you were having deficits or you might not be ready yet, and they would be realistic. And I love that about them because it's a tough conversation to hear. No, last thing you want to hear is that you still need to be there. But the best thing that they're there to tell you is, Mike, you're still doing this wrong, or you're still running into that. You still need help with this, and you over time, as you go along, there are these progress report. You notice as you start to move along their journey is that they're not as worried about some of the things they were worried about when you first got there. So those types of um, movement through the journey is going to be unique to each person. There's some people that I know did use a therapist more than I did. Um, that's good for them because that person was there for them. And one of the cool things that they do at CNS, and I was there during the Thanksgiving holidays, is that the therapists got together, different fields of therapy, got together and said, Mike, you're going to help with this team of people cook a turkey dinner. I was like, what? And so we made Thanksgiving dinner. We made it for them. We made it for us. And you just don't cook it. You clean utensils and you clean everything too. So what I love is that there's camaraderie because now you're cooking together with your co-residents, but also with the therapist, but also you are learning how to cook. And these are things that when you go shopping, they have an expectation. You're going to make your own meals. So don't buy anything complicated when you do that. I'm like I said, I'm a huge fan, but everybody's journey is going to be different. And I to this day see how lucky I was, but I was lucky enough because I was able to go to CNS, I was able to get the therapy. And here's another thing that I love is that I would ask the PT therapist, physical therapist, would say, "What can I do when I go home?" Because I would go home on the weekends, and she said, "These are the exercises I would do." And I gave them to my wife. My wife was like an external physical therapist. She was deputized as the physical therapist. She go, Michael, get back. You have 10 more to do. So what I love is that they did give me what they call home exercises to do because again, all of this is additive and it's to help you journey along so that you can get better.
Well, you said that so well. And not only does the evaluation need to be comprehensive and we need to tailor programs to the individual, in terms of their outcomes, what they want to achieve and kind of how their injury affected them. But you said something really important too, is how do you continue to measure it and readjust as necessary? And programs need to be flexible. They need to be changed as you go through the program. And I think that's a really good point. And I love that we deputized your wife as a physical therapist. I absolutely love it. So you went through this rehab process, Michael. Did you make it back to work?
So I did. I've been back to work since February. I work from home, which is lucky enough for me. I do all my calls mostly in the morning. So if I'm tired in the afternoon or a little less energetic, I have already had all my meetings. It's been going well. And let me tell you, it's been a journey, but it's been a good one. The fact that I can drive was really helpful because then I can participate in helping take care of the kids, getting them to baseball or helping my daughter get to theater camp. These are all really important things that CNS was a part of. That I were part of. I call it the building blocks of your journey back to your life. Again, some people are going to be wheelchair ridden, or they have to be in a wheelchair for the rest of their lives. And I understand that, but they will learn from CNS how to cope with that piece of equipment, how to best move along in their journey. It may be that they are going to speak differently and speak better. And, I'm grateful to CNS for everything they did.
Well, thank you. And after 6 months of intensive therapy, your story is absolutely amazing, and one that really does need to be told, because being on one side of healthcare and then the other, you have a unique perspective. Being a doctor in the ER and a consultant in the healthcare industry for decades, and I appreciate all the kind things you've said to CNS, and we are so fortunate to be part of your life. If you're kind of boiled down, what stood out to you most about CNS, maybe two or three things as a patient, what would that be? What was the most impactful?
Yeah, that's a great question. And we don't have enough time for me to go through all of them. One thing that I would tell you is it's the people. And as you well know, as a clinician, um, you cannot, and me as a clinician, you cannot do your job without people who care. And there isn't a single person that didn't care. And no matter what the job was, whether the job was to just come and watch you at the house or the job was as a therapist, the people were amazing. And everybody at CNS was just phenomenal. I mean, I remember putting up the Christmas tree as part of my therapy, but when we did that, there was a sense of pride that we did it together, and we did it with a team of therapists that were there. You just really take pride in that piece. So that's one, is the people. Two is the actual therapy sessions themselves. You don't really get a sense every day when you're doing it because it's so every day. You just go to physical therapy, you go to the PT or OT, you go to cognitive rehab, but all that you do these reading passages, and you get questions on them, and then you get graded. I started out at a fourth grade level of reading. By the time I finished, I was at the college level. It takes time, and I would say that one thing, the third, so it's people, it's the therapy sessions themselves, and lastly, it's going to be you. And what I would recommend to most people is just be patient. Your body's going to tell you you're ready to go, but they're going to tell you you're not ready to go, and that is the most important. I mean, I could have left at any time, right? Nobody was making me stay there, but I wanted myself to get better. They wanted me to get better, and I had to trust that the therapist knew what was best. And once you relinquish that trust into their hands, you're gonna get right through it, no matter what. And I do really think that that is the biggest take home message: is just you got to really trust the system.
I love what you said. There's so many nuggets there, from the care that's there from the people, the human aspect, the quality, but also to guide you down this path, people who've done this before. And, Michael, I've been on the other side of healthcare with my mom having a brain injury and an uncle, and it changed my perspective as a clinician and as a healthcare executive. Healthcare, in many ways, can be calloused. It can be very complex and very confusing. And I took a lot of lessons from those personal experiences, and how then I behave differently and lead differently in our organization. And I just wonder how this experience as a patient at CNS has influenced how you see healthcare, and has it really changed your approach to your own work?
No, that's a great question. It really has. So I also went through what you went through, which is my dad had a stroke. I'm adopted, so it was not genetic, but to see him go through that, and he eventually passed away as a result. Um, I've been on the other end of a caregiver of medicine. To be a patient is humbling, and it isn't about you not getting what you want and things. It's just about the process of what it takes. So one thing that I would take from this is the experience of being on the other side of what it's like to be patient, and it has influenced what my understanding of what other people go through. So first off, in what I take when we take care of patients, I think of the journey. I think of that it's not just the patient; it's their family, it's the social determinants of health, the things that that have nothing to do with health, that are going to be specific to why somebody is sick or why their chronic disease is chronic. The one thing that I will take away the most from this is what it feels like to be a patient. And when I go for a walk every day, I think back to the days when I had the walker at CNS or when I had the wheelchair, because I'm able now to get to walk. But when you don't have that luxury, we take it for granted. And for me, that's one thing I'll never do, and that's what I take in my job now is that you don't take anything. Life is not promised, but mostly you don't take things for granted, and that it is around the specific patient journey, and everybody's is unique, but you got to help people along that journey or else they're gonna get lost. And I do think about my wife and how she had to try to interact with the insurance company. Her interactions with CNFs were amazing. She would email the lady that was in charge of our care, and she always got an answer that day, through email or phone call. There wasn't any time where my wife goes, they never call me back. Th- That is to say, to have that access is huge. And I think this one of the few spaces where you're going to have the the care, but also the attention to detail, not just for the member going through the care, but the family members who are taking care of the person who had the stroke. So I do think that that's important, and I'm like I said, I'm always grateful.
Well, Michael, there are so many invaluable insights that you've offered during this podcast. So many really big takeaways from, the stroke and your course of care, the family, the quality, the communication, making sure that people get access. I think all of that is very important. Are there any other takeaways that you might give perhaps perfectly healthy people, or someone who may be thinking about this even prior to the stroke? What are the takeaways even before the stroke that you might offer our listeners?
So my take-home message and biggest takeaway is always check your blood pressure. And I know it sounds stupid, but through LinkedIn, and I put out my story about having gone through this stroke, and one person wrote back and said, because you had hypertension, I checked, and it turns out I have undiagnosed hypertension myself. So that's one life saved. So check your blood pressure. It's the biggest take-home message I can have. The second is, I'm biased because it helped me, but therapy, no matter where you go, get therapy. And then I just really think that in the long run, you can't do it by yourself. So you're going to have to need some help. And I do really think that having a place that has a comprehensive program that looks at all these aspects of your care is really, really key. And then the last thing is just really, it's about your family. Make sure, I mean, One thing that saved me, and I highly recommend this to anybody if they have this as a benefit, is to get the disability because had I not done that, we wouldn't be in our house because I would have had no, part of the disability was to get a paycheck while I was in rehab. You don't think about that stuff. And it really, so if you have that as a benefit, sign up for tomorrow, is what I would say.
That, and that's something we don't talk about too often. I think that's a really important part. The financial takeaways that we need to do to prepare for perhaps a life circumstance like this. Yeah. Well, Michael, my takeaways, it's vast. Number one, to it's important to get help quickly, and that's exactly what you did. And you said it multiple times, to be able to get treatment by the right people at the right time with the right specialization, and making sure that that rehab is intense and that it's effective and it's being measured. And it's critical that people get access to the right care post stroke and brain injury to reduce the disability, maximize that independence, and to resume their roles as moms, dads, students, truck drivers, physicians, right? And and also to check your blood pressure. And what I say is, when prevention is no longer an option, what do we need to look at? And I think that there's a lot to be learned on the other side of that injury. And what you've provided today is absolutely invaluable. So I want to thank you, Michael, for joining me. We're so glad that you were able to be part of CNS and that we were able to be part of your life and your family's life. Thank you for coming to talk to me today.
Thank you so much. And I'm so proud to be part of what they call the CNS family. It really is a family, and I'm grateful. But thank you so much for the time today.
Thank you.